Liposuction is a procedure where we remove fat from different parts of the body. It literally can be all over. Sometimes it's in the face, sometimes it's in the neck. Probably the most common area that we do liposuction is in the abdomen and midsection, hips and flanks. Basically what happens is we make some small incisions, 3 to 4 millimeters in length. We use that as a port to inject what we call tumescent fluid, which is a combination of IV fluid and some medication, including epinephrine and anesthetic. We infuse that into the area that we're going to liposuction and allow that to sit for several minutes prior to putting in the actual cannula that does the work. It basically slides through the tissue with a negative pressure or vacuum, so to speak, and as the cannula is moving through, little pieces of fat get caught in the tip of that and get aspirated or pulled into a container. And that fat is then gone forever. So this is a contouring procedure where we're trying to debulk areas where there's more fat. Lateral thighs in women, abdomen and flanks for men and women are super common areas. We also do it in the chest for men for gynecomastia. Sometimes for small reductions in women, we can even do liposuction of the breast. Basically, it's small incisions. Even though it's small incisions, though, the pain sometimes is a lot more than you'd expect, and the reason for that is that the cannula passes through in and out thousands of times with each procedure, and that can cause soreness, but the equivalent of doing a lot of sit-ups or a muscle ache. The other important part about liposuction is once all that fat's removed, it leaves kind of an empty sponge area in there, and we don't want fluid accumulating in that area. So an important part of liposuction is wearing a compression garment after your surgery for a given period of time to allow that skin to heal back down and close off the space where the fat cells were. In general, fat does not grow back after it's liposuctioned. People can still gain weight after they have liposuction, but all they're doing is growing the fat cells that are still there. So fat cells are like a balloon. They can be empty or they can be full. And when we remove a certain number of fat cells, it helps with contour because even as you gain weight, you're not gaining it in the same proportion that you did prior to your liposuction surgery. Recovery for a liposuction procedure, I say for most people, is about 2 weeks. The incisions are small, so we're not worried about incisions opening up. But there's a substantial amount of soreness, and we do want the skin to stick down after we remove the fat underneath. So I recommend that my patients don't go back to regular or strenuous exercise for approximately 2 weeks after a liposuction procedure. After that, they can pretty much get back to normal activities, but not working like the no pain, no gain thing, because sometimes there's a substantial amount of soreness, particularly in the abdomen, and you want to take it easy when you're getting back to full bore activities.